Why? Health checkups. You should avoid after 70 that may harm you more than help. Stop blindly following every medical screening invitation just because it's on your calendar. After age 70, the overdiagnosis trap becomes a literal minefield for your health. You're being pushed into invasive tests that often lead to cascade effects, unnecessary surgeries, and toxic medications for issues that would have never harmed you in your lifetime. If you don't learn how to filter the high-risk routine checks from the life-saving ones, you are risking your independence for a lab result that might be completely irrelevant. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with medical overtreatment for life. The first checkup you need to reconsider is the routine colonoscopy once you hit your mid-70s. While screening is vital in your 50s, the risks of bowel perforation, anesthesia complications, and severe dehydration from the prep often outweigh the benefits for seniors. Medical guidelines now suggest that if you've had clear results for decades, the slow-growing nature of these issues means the test itself is more dangerous than the condition it seeks to find. You have to ask, is the peace of mind worth a week in the hospital from a procedure complication? This is where the system fails you. Doctors are trained to look for problems, but they aren't always trained to consider your quality of life 24 hours after the test. This screening momentum can lead to a downward spiral of fatigue and loss of mobility. This is exactly why my Elite Vitality Masterclass is so essential for those over 70. We don't just look at data, we look at functional vitality. We teach you how to become your own biological advocate, so you aren't bullied into procedures that steal your energy and your time. Next on the list is aggressive prostate cancer screening, PSA tests, for men over 75. Science shows that most men in this age bracket will have some form of low-grade prostate change that will never spread or cause symptoms. However, a high PSA reading often leads to painful biopsies and treatments that cause incontinence or impotence. You're trading a symptom-free life for a life of side effects. It's time to stop treating numbers and start treating the human being. Your vitality depends on avoiding these unnecessary medical interventions. Third is the routine pap smear for women over 65 or 70 who have a history of normal tests. The risk of developing new cervical issues at this age is statistically near zero, yet the stress and discomfort of the exam remain. Why subject yourself to the anxiety of false positives that lead to more invasive testing? The modern medical machine thrives on just in case, but just in case is exactly what leads to the medicalization of aging. You deserve to live without being a patient every 3 months. The fourth dangerous checkup is the overtreatment of mild high blood pressure. While stroke prevention is the goal, many doctors try to push a 75-year-old's blood pressure down to the level of a teenager. This leads to orthostatic hypotension, that dizzy feeling when you stand up. For someone over 70, a dizzy spell leads to a fall, and a fall leads to a hip fracture. In many cases, the treatment is far more lethal than a slightly elevated blood pressure reading. We need to prioritize balance and stability over a perfect cuff reading. In the Elite Vitality Masterclass, we dive deep into the longevity sweet spot. We show you the exact markers that actually matter versus the ones that are just profit drivers for the industry. We help you rebuild your natural vascular tone so your body regulates itself without needing a cocktail of pills that make you feel like a zombie. If you want to keep your wits, your strength, and your freedom, you need a blueprint that respects the unique biology of an older, wiser body. The fifth screening to watch out for is aggressive cholesterol testing and subsequent high-dose statin therapy for primary prevention in the elderly. New research suggests that for those over 70, higher cholesterol might actually be protective against cognitive decline and infections. Forcing those numbers down can lead to muscle wasting, sarcopenia, and extreme fatigue. If you can't walk around the block because your cholesterol medication ruined your leg muscles, has that medication actually helped you? The answer is a resounding no. Modern medicine often forgets that the goal of health is to live a high-quality life, not just to have clean blood work. If you are constantly recovering from the side effects of preventative care, you aren't living, you're just lingering. The Elite Vitality Masterclass focuses on root cause resilience. We teach you how to fuel your mitochondria and protect your brain so that your body stays robust enough to handle the aging process naturally. This is the raw truth that the mainstream system isn't telling you. You are at a crossroads. You can continue down the path of being a perpetual patient, following every outdated guideline that treats you like a statistic, or you can join the elite group of seniors who are taking their power back. My course provides the raw, clean script for how to talk to your doctor, which tests to demand, and which ones to walk away from. We give you the confidence to say no to over-medicalization so you can say yes to more years of active, vibrant living. The medical industry is a business, and checkups are the top of the sales funnel. By staying informed, you protect your bank account and your biology. Remember, your body has an incredible capacity for repair even after 70. Provided you stop interfering with it through unnecessary chemical and surgical stress. The Elite Vitality Masterclass is your shield against the overdiagnosis epidemic. Don't let your golden years be spent in waiting rooms and recovery wards. The information I'm sharing with you today is backed by the latest geriatric research, yet it takes an average of 17 years for this data to become standard practice in your local clinic. You don't have 17 years to wait for the system to catch up. You need to apply these high-efficiency health hacks today. By joining the masterclass, you get immediate access to the cutting-edge protocols that the 1% use to stay sharp and mobile well into their 90s. We also need to address the mental fatigue that comes with constant medical monitoring. Every suspicious result that turns out to be nothing is a massive hit to your nervous system. This chronic stress accelerates aging faster than almost anything else. In our program, we teach you neurological buffering, techniques to keep your stress hormones low even when navigating the healthcare system. This keeps your heart healthy and your mind clear, which is the real key to longevity. So, how do you start? You start by questioning the routine. The next time a screening is suggested, ask your doctor, what is the absolute risk reduction for someone my age, and what are the chances of a false positive? If they can't give you a straight answer, you need a better plan. That plan is the Elite Vitality Masterclass. We empower you with the vocabulary and the biological knowledge to lead your medical team, rather than being led by them. The final habit that 99% of people miss, the one that keeps you from being stuck in the medical topic loop for life, is the active advocacy audit. Before every appointment, you must write down your function goals. If a test or pill interferes with your ability to walk, play with grandkids, or think clearly, it must be rejected. Most people let the doctor set the goals. The 1% set their own goals and make the medicine fit the life, not the other way around. By adopting this audit habit and combining it with the cellular nutrition and movement strategies in the Elite Vitality Masterclass, you become virtually unkillable by the standard medical system's errors. You'll have the energy of someone 20 years younger because you aren't being drained by unnecessary care. Click the link in the description to secure your spot in our next session. Let's stop the overtreatment and start the real living. Your best years are still ahead of you, provided you stay out of the trap. Subscribe. Which advice will you start applying today?